Hello, I am Kayla Roman. I'll be highlighting top professionals providing senior financial services. Today we are meeting with Sean Pierce. Hi, Sean, how are you?
Good morning, Kayla. How are you doing?
I'm good. Could you start off just by telling us a little bit about yourself, your family, hobbies, things you like to do outside of work?
Sure. First of all, thanks for having me today. My name is Sean Pierce. I live in Western Pennsylvania, and I started a small insurance agency. This is my fourth year on the cusp of working for insurance companies for upwards of 20 years prior to this. Led me to kind of go out on my own, and I feel like it's just the best way to kind of get involved and help seniors with some of the choices they have to make. Outside of that, I am a father of four children with 10 trillion activities and different things going on with that. I can relate well to seniors too, because we also have my father-in-law who lives with us who is dealing with dementia as well. So lots going on outside of life. Very enthused every day to wake up and see what kind of impact I can have on with seniors aging into Medicare, and also with people in general, people running small businesses that need insurance for their employees is something that I get involved with pretty heavily as well.
Great, thanks for sharing that. What led you to working or getting into insurance in general?
I don't know that anybody grows up and says someday I want to be in insurance per se. But as I stated earlier, I spent 20 plus years working with different insurance carriers. So I kind of have a view, if you will, or a lens for sort of what the insurance companies are trying to do and accomplish and provide. And I guess it's interesting. I'm very appreciative of that experience. But I noticed as I learned more and did more and maybe even got promoted in that space, it seemed like I kind of got further and further away from what I would deem the end user or the client. And starting my own agency allows me to kind of sit across the table from somebody and talk to them about humanistic values and figure out kind of what's going on with them and try to tailor that to what their insurance needs should be.
Yeah, thank you. And what led you to working with seniors specifically?
I just kind of backed my way into the space, to be frank. I've worked in others of insurance on the property and casualty side. I also spent a block of time in my life training clients on how to prevent accidents and workers' compensation. And my skill set around project management led me to picking up a few projects on the health and life side. And that's kind of how I got introduced into the senior space, just doing some corporate work for some of the companies I had been with. And I have to tell you, insurance, I guess at times can be maybe dry depending on who you ask, but the personalization of creating programs to work well for seniors, one of the things that really kind of steered me to this space permanently was the realization of my own dad approaching retirement. And he started to tell me about the floods of mail and phone calls and everything he used to get when he was getting closer to Medicare. And he said, Sean, this stuff is so overwhelming. And it just sort of led me to a place where you would think when you enter retirement age, if you think about it, it's kind of like when you want to kind of shut the brain down a little bit and relax. And it's really the opposite. There's still a lot of critical and important decisions to make and a lot of thinking that needs to be had. And I just felt like my skill set played well there. So I love having conversation with seniors, learning about them and trying to position them upon learning more about them, how to pick up this piece, whether it be the insurance piece or even some financial service activity. It just seems to have been a really nice maturation. So as I got into Medicare and learned about who the end user was, I've never left it. I've been in it ever since.
What are some of the biggest challenges you see your clients facing?
Medicare at its core, I think the belief is if you pay into it your whole life, eventually they just kind of like send you a card and you're set after that. And it's really not that simple. There's some complexities that come with in getting involved with Medicare, understanding what it is and what it isn't, what it covers and what it doesn't, what it costs and what it doesn't. And for seniors, they're getting hounded with essentially, I tell them, when you're entering 65 or your retirement age, frankly, there are a lot of seniors now working beyond 65. But when you get to that place, you kind of have a target on your back. You're getting calls from national call centers, both onshore and offshore. You're seeing floods of commercials and advertisements and a lot of mail. And you start reading some of it. And before too long, some of the language is confusing. Some of the terminology has some complexity. And you go, what am I doing? I have no idea what to decide. So it really just creates a good opportunity to kind of be an expert in this space, which I've become over time, and puts me in position to really provide some peace of mind. Being independent like I am takes the pressure away as well. I'm really focused on the education and them understanding. If we're going to pick an insurance product, it's fine to kind of talk about the pros and cons of one insurance company versus the other. But I'm really focused on how it works when they use it. And once they understand that, that puts them in a position to really evaluate, okay, now let's look at the carriers and the pros and cons of those. So the path is an interesting one, and it leads us to a good place in the end.
Can you give me an example without divulging any specific details of a time that you helped a client with some specific needs that they had, and it was really impactful for you to see them achieve those goals or overcome a certain challenge?
I mean, there are lots of examples. The area where, if we're going to talk about Medicare, where you can really have an impact is with seniors that maybe have a lower income combined with a lot of medical needs. Some of those people are on the cusp of really being in a bad spot financially if one or two things wrong go happen to them medically, or if in fact maybe they're a diabetic or have a couple other things that are costing a lot of dollars as it relates to prescription medication. Being able to get to them at the ground level and say, hey, there are resources out there. There are ways to get extra help for your medication. There are ways to position you so we can mitigate your out-of-pocket exposure, and you can really just focus on getting the treatment that you need is very impactful if it's explained well enough. And there are some folks that obviously, in addition to Medicare, need Medicaid as well or qualify for Medicaid, and they don't know it. So when you accomplish that for somebody, it really takes a lot of the financial burden off of them and puts them in a position to be focused on just kind of what they have going on medically. And I have countless examples of that.
If you had a crystal ball and could see into the future, what do you see being the biggest challenge in the next 3 to 5 years for seniors in the senior financial market? We won't hold you to it.
Well, the current batch of seniors, maybe the baby boomer generation, I think the challenge has been kind of, the world's basically digitized at this point. That crop of seniors coming through maybe don't have the technological skills, and I'm seeing that shift pretty quickly. So I think that's really been a challenge the past couple of years. Some clients that I have, really don't even use email or just don't deal with technology well. So the personalization is extremely critical. The ability to pick up the phone and have a conversation or bring them to my office, remains important. Going forward, I simply would say, like anything else, things change. There's a lot of conversation about the future of Medicare and its sustainability, based primarily off of a lot of the volatility that's going on in Washington and the bipartisanship stuff that's going on. So I think just continuing to be an advocate for them as the world continues to evolve and change and always be quick and fast paced, being a liaison for them to kind of explain to them kind of what's going on, from a macro level and bring it down to a micro level and position them well is kind of what I see in the next couple of years.
All right. Well, Sean, thank you so much for meeting with me today. I really appreciate it, and just sharing a little bit about you and your experience and a little bit about your clients. I really appreciate it.
Thank you, Kayla. It was a pleasure.
All right. I'll talk to you later.
All right. Bye-bye.
Bye.